الرحيم أسعد الله مساءكم جميعا. Good evening everyone. It's a pleasure to be with us today, inshallah, in our specialized and structured series that emphasizes on the role of leadership in advancing patient safety in healthcare settings. This series consists of three consecutive webinars developed by Saudi Patient Safety Center as a WHO collaborating center for patient safety policies and strategies, in collaboration with WHO, AMRO, to assist in shaping healthcare leaders' capacities, and will be delivered through a group of distinguished speakers and moderators who have multiple and rich expertise into this field. Uh, Let me introduce myself. My name is Bandar Al Jasser. I'm the Executive Quality Director at Saudi Health Holding Company, and today we're having our guest speaker is Dr. Dina Ismail, who is the Executive Director of Healthcare Leadership Academy at Saudi Commission for Health Specialties. And she will present today a very interesting topic about fostering patient safety through emotional intelligence. And this is a very important topic that will shed lights on how we utilize emotional intelligence into patient safety, and also how we utilize this to promote and foster patient safety to our patient and to our staff as well. Please welcome with me Dr. Dina. Dr. Dina, we are really glad to have you today, and the floor is yours.
الله يعطيك العافية. Thank you very much, Bandar. Good evening, good afternoon, wherever you are. It gives me great pleasure to be with you this evening to talk about the impact of patients' emotional intelligence on the safety of our patients. I'll be sharing with you a few slides, and during which, if you have any questions that pop up, just keep them in the chat or in the Q&A, and later on, whenever I'm done with my presentation, we'll take the opportunity to take all of your questions. So starting off the presentation, let us just show a bit of numbers. So according to a research done in 2004 by Stanford Research Institute with in collaboration with Carnegie Mellon Foundation, they found that 75% of your success is dependent on emotional intelligence, while only 25% on your technical expertise. Imagine 75% on your emotional intelligence, and all of your learning, your education, your technical expertise that you took years to build and develop, it only matters to 25%. So it shows you how important is emotional intelligence and impactful on your career. However, there has been massive research that is done to relate and link emotional intelligence to patient safety. One of the famous research that was done in 2017 was published by the American Journal of Nursing. They asked the question, could emotional intelligence make patients safer? And this is what we will be exploring this evening, and see if emotional intelligence really impact patient safety. So to start off, I'll just give you a brief about the outline that I'll be covering. So I'll be talking about the definition of emotional intelligence, the building blocks and competencies of emotional intelligence, the impact of these competencies on patient safety, and how do we foster emotional intelligence within our organizations. So to define emotional intelligence, and sometimes they call it for short EI. So emotional intelligence is 4 aspects: your ability to recognize and label your own feelings, your ability to manage these feelings, and your ability to recognize the emotions of others, and your ability to manage relationship with others. And I always make it easier for people when we talk about emotional intelligence. I'll tell them that emotional intelligence is 2 things for you and 2 things for the other people. 2 things for me is I recognize my feelings, عندي هذا الوعي بعواطفي, and managing your own feelings, so managing how you handle your feelings, especially your disruptive feelings. And so these are the two things for me, and the two things for others. So recognizing the emotions of others and managing that relationship with others. So let's talk further. So this definition was defined by Professor Daniel Goleman. He's a professor at Harvard Business School. He's done massive research. He's highly published. He has a lot of books published and around the world, translated in different languages. A number of these books are translated in Arabic, to my knowledge, but I assume they're translated to different languages. So we consider him as a guru of emotional intelligence. So in his updated research in 2017, he talked about emotional intelligence has building blocks. And these building blocks are a reflection of the definition that I just gave you. So the first block is self-awareness. الوعي بالذات. The second block is self-management. إدارة الذات. Second block is social awareness. So your awareness of other people, and then relationship management. So these blocks, under them, will have different competencies. So they branch out to smaller competencies that we need to improve to help us create and achieve and develop those building blocks. So what are the 12 competencies? So under self-awareness, the competency is simply self-awareness, being aware of your emotions, being aware of what's happening with you emotionally, psychologically. Then self-management. And under self-management, we have 4 competencies: emotional balance, adaptability, achievement orientation, positive outlook. Social awareness, we have empathy and organizational awareness. And finally, relationship management has 5 competencies: influence, coaching and mentoring, conflict management, inspirational leadership, and teamwork. Of course, we only have an hour to cover, so I cannot go through all of them. However, I selected the top 6 competencies that I felt impactful on patient safety and in healthcare in general. So let us deep dive and relate these competencies to patient safety. So the first one, let's talk about self-awareness, أو الوعي بالذات. So self-awareness is defined as the capacity to understand how our feelings affect us, other people, and our performance. So how my emotion can affect me, my performance, and impact the people around me. Whenever we create that understanding and awareness, we can manage. You cannot manage what you're not aware of. So the first step is developing that awareness. Healthcare providers with high levels of self-awareness are better equipped to contribute to safer and more effective healthcare environment, because they are aware, I am tired, I'm exhausted, I'm mentally burned out, I cannot focus. So all of this awareness will help them make better decisions during taking patient care. So how does self-awareness impact patient safety? Well, you recognize your limitations. So me being aware, I know that I'm not able to do this procedure at this moment. Me being aware, I know I am limited in the resources. I'm not Superman. I cannot save the world. Understanding this, it helps you recognize your limitation and then be more creating a safer environment for the patient. Also, it helps you continuous learning, because I am aware that I'm not knowledgeable enough. I don't have enough knowledge. I don't have the learning, the capacity to do this. It helps me to continuously learn, develop my skills, develop my capabilities, develop my competence. Being aware that I need to continually develop will help healthcare providers be more competent, which later on leads to better patient safety. The second block is self-management, your ability to manage your emotions. So I am aware of my emotion. So to manage them, I need to be to manage them, have that competency of self-management. Under it, we have adaptability. Adaptability بالعربي عندنا التكيف. So our ability to adapt with all changes that are happening. And emotional balance. How do I create that balance in my emotion during disruptive feelings, sadness, anger? All of these are disruptive emotions. How do I create balance and manage them better? So, starting off with emotional balance, it's our ability to keep our disruptive emotions and impulses in check, to maintain effectiveness under stressful or hostile condition. So, for example, there is a hostile condition, people are angry, emotions are flared, so we are under stress. So how do you keep those emotions in check, balanced while there is chaos around you? Emotional self-control is a critical skill and plays a significant role in ensuring patient safety, because your emotions are not impacting your decision making. You're not impacting your communication. So all of that will impact and reflect of how patients are handled. So impact of emotional balance will have an impact on communication, how we communicate with one another, and how do we manage disruptive behavior within the work environment. So whenever I have high emotional balance, which means I have high emotional intelligence, it means that we can manage disruptive behavior in our workplace. Communication is one of the important skills that can impact patient safety. According to the Joint Commission in I'm sorry, this is covering me. In 2002, they found that 55% of medication errors are caused by poor communication within the team, while 65% of sentinel events are caused by poor communication. So this makes us realize how communication is very important to patient safety. In 2022, a recent report on the study, it stated that when analyzing the root cause of sentinel events, communication breakdown continues to be the leading factor contributing to sentinel events. So still, with all of the improvement, with all of the education, communication is still one of the challenging elements, and that could cause impact patient safety. 70% of medical errors are a result of poor communication, according to a 2016 study. So this makes us realize the importance of having better communication within our team to result in better patients' care. According to a 2008 Joint Commission study, they found that 65% witnessed disruptive behavior in nurses. And the majority of these individuals who witnessed that behavior are nurses. So nurses reported that they saw 65% of nurses witnessed disruptive behavior coming from other nurses. And 77% of respondents, which majority of them were nurses, witnessed disruptive behavior in physicians. So such disruptive behavior, looking at these numbers, it's prevalent. And this reflects that sometimes disruptive behavior can create a breakdown in team spirit, breakdown in communication, and all of that can impact directly the patient care and the patient care delivery. So how do we foster better emotional balance? How do we create that balance emotionally during disruptive time, during crises, during burnout? Well, since emotional balance impact communication. So it's important that we have some sort of standardization of our communication tools that we use. And we do have many of them in healthcare, like ASPAR, IPASS, Team Steps, not only tools, huddles, let's say like a lot of people, a lot of hospitals will use rounding, will use whiteboards. So whatever tools we agree on, we need to standardize them. I've noticed sometimes in some hospitals, you'll find that disparity between departments. So you'll find some departments like pediatric ward, they're very active. So they use ASPAR, they use IPASS. However, you go to another ward, like surgical ward, they don't care about those tools. So it's very important that we decide and agree on the tools that we're using. We standardize them in our communication. We embed them in our policies, embed them in our performance reviews. We embed them in our training. So we have them, we foster them and foster better communication within our team. Also, offer training and coaching. This can help improve that emotional balance and help support employees with feedback, with guidance to help them improve their emotional balance. Also, commit to a culture of zero tolerance to disruptive behavior. When the organization does not tolerate disruptive behavior coming from physicians, coming from nurses, coming from anyone working within the organization, this will help people keep themselves in check. We want it to come naturally, but sometimes we need to have policies that protect the patients and foster patient safety. And finally, develop policies and processes that define appropriate behavior standards. Sometimes the definition of the behaviors it's reflective of the culture, and we need to have policies that clearly defines what is the appropriate standard acceptable within this organization. And many organizations have them, like the code of conduct, how to behave, ethical assessments. So they do have them, but we need to ensure that they are reflective of our culture, of our organization, of our nature, of how special our culture is. This will help us define what is appropriate for us. We all agree on and develop and train and coach based upon it. And finally, hold staff accountable for their action. If people get away with it, they'll continue to do it. So we need to hold people accountable for their actions, for their behavior when it's disruptive to the team and can be impactful to patient safety. So emotional balance, تكلمنا عنها. So let's talk about adaptability. So adaptability, it's a second competency under the block of self-management. So adaptability is the flexibility and handling change and juggling multiple demands, adapting to new situations with new ideas and or innovative approaches. So adaptability is a leadership skill that we're currently talking about a lot in leadership training. Adaptability نقصد فيها التكيف. So the ability that people adapt to all of the changes that are happening. And we usually, when we talk about adaptability, we'll see that healthcare professionals who are adaptable can respond to change effectively with uncertainty and challenges, and ultimately contributing to a safer and more resilient healthcare system. More resilient healthcare system that can be resilient under a lot of changes that are happening. And we usually talk about in leadership, we talk about handling what we call VUCA. And VUCA is an acronym for 4 words: So V for volatility, and it's unpredictability that things can happen around us, like pandemics, healthcare crisis. Let's say it could be also on a positive side, volatility, like when there's rapid innovation of different protocols. So, for example, if we have AI-driven diagnostics, we've always used the same protocol forever, and now we have something new. So adapting to that change and that new methodology of conducting our practice, it, it, we need to adapt. We need to accept and change to embrace that change. U is for uncertainty, عدم اليقين. Uncertainty, it's the lack of clarity about the future. We're not certain what's going to happen in the future. Regulations can change, emerging diseases that can happen that we're not aware of. We could have, our medication does not work anymore, as when we talk about antimicrobial resistance. So what if all of our antibiotics don't work anymore? So we don't know how to treat pneumonia, for example. So this is making it hard for us to plan for the future because we're uncertain of what's going to happen in the future. The C goes for complexity, أو التعقيد, because of the independence of different elements. Everything is interconnected. There is a lot of multi-sectors coordination for healthcare to happen. We have like hospitals, we have insurers, we have governmental agencies that regulate, we have pharmaceutical companies, we have a supply chain worldwide. So all of that is complex. And interdependencies globally. So the supply chain of medication, the workforce migration, we all saw this during COVID. And we realized how complex is healthcare. Not something easy. It's not our hospital and we're in our bubble. No, it is a very complex system that we have to handle and deal with. And finally, A is for ambiguity, أو الغموض. Ambiguity, it's a lack of clear cause and effect relationship. We really don't know what's a cause and effect relationship of a lot of things that could happen. If we do this, what will happen later on? So, so let's say adopting digital healthcare. So how will it impact the outcome of patients? This is something we're still not certain of. We still need to study it for years to see does healthcare improve with using digital adaptation, or it's better with the classical way. So all of this goes under ambiguity. And all of this is VUCA. And you'll hear it a lot, people talking about VUCA. We live in a VUCA world. We're challenged with VUCA. So it's an acronym for volatility, uncertainty, complexity, and ambiguity. So for us, as individuals working in such system that's volatile, uncertain, complex, and full of ambiguity, we need to be adaptable. نحتاج نتكيف with all of these changes and all of that complexity that is around us. So how adaptability impacts patient safety? Well, being adaptable helps us respond to changing conditions. It's like when COVID happened, we were able to respond to it. We were adaptable. We worked together to adapt to all of the changes that are happening. So we have to work afar. We have shortages in our medications, shortages in our supply, shortages in our all of gloves, masks. So we had to adapt to all of these change. Ration, we have to think outside the box. How do we treat patients? So this helps us whenever you're adaptable. And we saw people during COVID who broke down and left the healthcare system completely. So I'm done with healthcare. I don't want to work in this field. It's too stressful for me. So your ability to adapt will help you respond to the changing conditions around you. And comply with regulations. Regulations continuously change, updated, new regulations every day. So your ability to adapt, you can work better with and comply better with regulations. And we can see these regulations every day coming. So either their WHO regulations, either their Ministry of Health regulations, either their Joint Commission, accreditation body regulations. So our ability to comply with them is part of being agile and adaptable. And agility is also a close sister to adaptability. agility اللي هي المرونة أو الرشاقة بالعربي ترجمتها. So being able to be agile and adaptable will help you handle all of these changes that are happening around us. So this is all part of self-management. If we move to the second block, which is social awareness, we will be focusing about empathy. And empathy is within the heart of caregiving and healthcare. Empathy is our ability to sense others' feelings and how they see things from their perspective. We always define it as putting yourself in the shoes of others, seeing it from their perspective. So this is empathy. Many studies have related and linked empathy to patient safety. One study published in 2019 stated that healthcare providers who are high in empathy had 80% lower odds of reported errors by patients. Another study showed that the study was from 2019 as well, that higher healthcare practitioners' empathy is associated with lower mortality in diabetic patients. So we could see that our empathetic communication, our empathetic interactions with our patients can impact their compliance, can impact their caregiving, can impact their recovery. So it's very important that such practice is followed to support the patient care. Another research that was published as well in 2017 found that the higher the empathy of the healthcare provider, the lower burnout rates are found with these healthcare providers. So empathy can help you as well and reduce the burnout within the healthcare provider's practice. So how does empathy impact patient safety? Well, empathetic communication can help improve how we interact with one another. Our empathetic communication could be through how we listen to each other, how we communicate with, respond to one another, our nonverbal communication with our patients. We're facing them, sitting in front of them, smiling at them. So all of this can impact how the patient will feel and how it reflects on you, reducing your burnout, helping you feel better about your work, better about your performance, your job, which later on make you more focused on the task on hand. It also builds trust among the teams, among your patient, yourself and the patient. So building that trust will help also improve your mental state and will help improve patient safety. The last competency that we'll be talking about is relationship management. So when we talk about relationship management, we focus on the competency of teamwork. And with teamwork, and conflict management first. So in conflict management, of course, we work in hospitals, we work for, let's say, 9 hours a minimum. So we spend more time at work in our clinics, in the OR, in the wards, more than we spend time with our families. So conflict is It's going to happen at some point. However, our ability to manage that conflict is the key. So our ability to help others through emotional or tense situation, to tactfully bring disagreements into the open and to define solutions that everyone can endorse. This is what we mean by conflict management, our ability to manage conflict. So it's inevitable that people will have conflict within our teams. However, our ability is to tactfully bring those disagreements to discussion and help us find solution that everybody agrees to. Employees, according to the Center of Psychology Press in 2008, they found that employees spend around 2.1 hours per week dealing with conflict. So almost a minimum of 2 hours a week we spend in conflict situation. According to that research, they found that the main reasons that we have conflict in organizations is one, due personality clashing and egos. Number two is stress. And number three, workload and inadequate resources. So all of this will create that conflict within their organization. We have a lot of demands. The load is high. We don't have enough staff. We don't have enough resources. We're in stressful situations continuously. And we have personality clashes among the team. So all of this can lead to conflict within the organization. In a research by Mayo in 2019, they found that 4 out of 10 conflicts among the team had the potential to patient care quality and impacting patient care quality and safety. So how can conflict management impact patient safety? Well, if we manage conflict better, it will help promote psychological safety among our team. And promoting psychological safety where people feel safe to voice our errors. It feels safe that we voice our mistakes. So it makes us easier. When I make a mistake, we can voice it. When we report incidents, we're not afraid. There is an environment of psychological safety. It also promotes just culture, and promoting a just culture where any error is analyzed for improving the system. So we're encouraged to report errors and mistakes to help improve the system without feeling the fear of being blamed or being held responsible for it. All of this will promote reporting, which leads at a certain, which eventually will lead to better and safer environment and patient care. So handling conflict better will help in return promote psychological safety and promote a just culture. And finally, we'll be talking about teamwork. And when we talk about teamwork, it's the ability to work with others towards a shared goal, participating actively, sharing responsibility and rewards, and contributing to the capability of the team. So all of us working together for the good of the patient, for the care, the quality of the care that we're serving. So this is what we mean by teamwork. Teamwork initiatives in a paper published in 2002 found that teamwork initiatives done within the organization has helped decrease the clinical error rate from 30.9% to 4.4%, dramatically, when they initiated different teamwork initiatives to build the team, to support the development of the team. And teamwork initiatives can be from simple things that we create within the work environment to help improve the collaboration among the team, the support, the communication, can help dramatically improve patient safety. Also, in another study in 2006, found that 50% reduction in adverse outcomes after team training in the maternity ward. So 50% of adverse outcome after they trained their team to communicate better, to work together, to understanding each other's roles, to understand that we all need to work together. We do not work in silos. We have to train all together. We have to work in a multidisciplinary team. So teamwork can impact the coordination of care. So if we develop teamwork, it can impact patient safety, where we'll have a better coordination of care for the patients and their family. And it will be easier to share knowledge, expertise, to break the barriers between the team. Where it becomes everyone has that team spirit where everyone can collaborate and interchange and exchange ideas openly and supportively. So, answering our question, could emotional intelligence make patients safer? Yes, through applying their blocks and the competencies of these blocks. So self-awareness, self-management, social awareness, and relationship management can all help at the end of the day support and foster better patient care. So in conclusion, the takeaway messages of this presentation is that emotional intelligence is a critical component of patient safety. Emotional intelligence can be cultivated within the organization through training, role modeling, feedback and reflection, coaching individuals, using evidence-based tools and resources to improve communication and teamwork, and interprofessional team building activities. All together will help develop a better and safer environment. And with that, I conclude with a quote by Professor Daniel Goleman. He says that by teaching people emotions, to tune in their emotions with intelligence and expand their circle of care, we can transform organizations from the inside out and make a positive difference in our world. And thank you very much. I'll hand over the mic to Bender to look at the questions and answer.
Thank you, Dr. Dina, for this interesting presentation. It was really informative, and it has a lot of information regarding the emotional intelligence and how we apply that into healthcare settings. It was really interesting. If you allow me, I'll just go through the questions if there is any. Until we got questions, maybe we can trigger this discussion with a few questions if you don't mind.
Sure.
Dr. Dina, speaking about the emotional intelligence, what strategies can hospitals implement to develop emotional intelligence among their staff as part of their strategies to change?
Well, since my background is in training and I come in training and development, I think developing training programs to talk about emotional intelligence, create awareness about emotional intelligence, training programs that are regular, simulation-based, so role play. All of this will help people be comfortable and open about what they're challenged with and what they need to work about. Also, I think mentorship. In healthcare, we work with different levels of seniority. So seniors with more experience, that they've seen it all, they've managed crisis. I think mentoring others, doing support groups where people can reflect, group reflection is very important as well. Emphasizing on interdisciplinary training and interdisciplinary practice as well. In the past, I used to see in the past when we used to do training sessions, we had training for only the physicians alone, and then we had the nurses all alone and others كده all alone. However, now we're talking about interdisciplinary training, where we have the physician and the nurse and the administrator, all of us sitting together and discussing the plan, the care, the learning all together. I think with emotional intelligence, one of the challenges that we have is stress. Stress that can impact the performance, can impact the emotional balance. Having different initiatives that create that work-life balance in the organization is very important. Being keen to train people about mindfulness, self-regulation, stress management. People should feel safe to talk about it. Now, we've witnessed how burnout can impact the healthcare system. And especially post-COVID, we saw a lot of people leaving the healthcare system. And we cannot risk that, where we took years to build people's expertise and learning. We cannot risk them leaving. So we need to create that balance where we keep people, however, we keep them safe within the organization, which in turn keep our patients safer.
Great. Also, one other question is maybe we'll follow the strategies. How can leaders model emotional intelligence to encourage a safer patient care environment, especially when it comes to the culture changes and this new model of emotional intelligence into our daily practice as a healthcare facility?
So leaders need to be the role models. So we usually, when working with an organization, will model our leaders, will mimic them. What they do, will do the same. So it's very important that leaders display the skill of emotional intelligence, where they're active listeners, excellent communicators, create inclusive environments, create psychological safety for our team, emphasize team building. And it's important that we have interprofessional meetings, so everybody is included, and في كده شمولية in how our decisions are made. I think also leaders need to be present in the clinical setting, in the bedside. They need to be seen within the ward. I cannot make decisions far away from the hospital. I need to be within the hospital. I need to either do rounds, participate in the huddles, pass by, the least that they pass by to see the staff, to talk with the patients, talk with the families, the caregivers. When staff see this, they will role model their leader. When they see them handling patients with empathy, listening to them empathetically, responding to them, all of this will being a role model and practicing what they preach in their meetings and their statements. So it's very important to be a great role model for the team.
That's
I'm not
very
sure if we
interesting.
have questions from the
I
audience.
can check the chats, but there is no other question.
Okay.
Maybe we have 4 minutes if you also allow me for another question.
Sure.
Being a executive quality leader, I can see in the hospitals that, as you said in your interesting presentation, the self-awareness and how we have this relationship between, especially the management and also the frontliners.
Mhm.
how we can create this empathy between the leaders, the middle management, and the frontliners, as well as between the frontliner staff and the patient themselves, how they should be more emotionally intelligent to feel how the patient feels, or from the point of view of the middle management, how they feel, how is the frontliners feeling about the care? When do they have the ability to speak up and being transparent within the process?
Okay, it's a
Yeah.
very good question. شكرا بندر. It makes you reflect how important that chain where the frontliner can performance can impact or the leader performance can impact the middle manager, how the middle manager will impact the frontliner, which later on will impact the patient and their family care. So all of it cascades. I think it's important in when we talk about empathy. I always say that none of us came into healthcare because we wanted better salaries. We wanted a better prestigious job. We wanted titles, because we all know that healthcare does not provide this. Yani, we're lucky if we get it, but it's not that we went into entertainment, social media. That's where all of the money and being famous. However, healthcare, all of us came into healthcare to care for patients,
Yes.
to deliver care. We have this passion, but sometimes due to stress, due to conflict, due to poor communication, being in the fog. And let me emphasize about being in the fog, especially who's impacted with being in the fog is the middle management and the frontliners. And so being in the fog that you don't know what's happening. So all of the leaders are meeting, discussing, coming up with strategies, all of that fancy words, and they're completely isolated. They're not involved. Although at the end of the day, they're requested to apply these policies and come up with the KPIs. So keeping me in the fog and keeping me in the dark, I'm not engaged. So you'll have this breakdown of disengagement where people are not participating, not involved, and there's a saying that nothing about me without me. So if you're making those decisions without me, how
Yep.
do you expect it to be about me? And I apply it. So it breaks down the engagement. So to create this, I think it's very important that people need to be involved. People need to be reminded why, ignited, why they're in healthcare. And they need to have the right environment to create that empathetic relationship with patients. Remember, there are some organizations that said patient first.
Yep.
And always patient first. And then later on, there were books about employee first.
Yes.
Because if you have a happy employee, automatically they will serve better. But if you have an employee who's disengaged, in the dark, stressed, they don't have the resources, they don't feel that they're heard, a lot of the regulations are unclear to them, they feel stressed out, automatically it will impact the patient care. So I think keeping them involved, reminding them of why they're in healthcare, their role in healthcare, and how do you remind them? A lot of organizations now will measure the patient experience, and to them it's just a number. However, we need to remind them why, what's the patients are saying. Sometimes that feedback is very impactful to patients and to providers. So when they feel that we're really impacting patient care, patients really felt happy of the service that we've done, we will ignite that. So it's not just a number where we achieved 90% in our patient satisfaction, making it as a story, making it as something that people can relate to, video, voice note, and experience that will remind people why they're in this organization, why they're working in healthcare, because many of the times it's there, but it's lost among الزحمة اللي صايرة. So all of the emotions that are happening to us, we completely forget why we're in this field to start with.
Yeah, continuing to your talk, Doctora. Now even the healthcare professionals who are engaged or involved in the Sentinel event, they called them second victims, because they're really traumatized about the incident that happened to the patient or the harm that happened to the patient. Therefore, even we us as leaders, we need to take care of those healthcare professionals and give them the psychological safety, the psychological support to make them even feeling safe to speak up, feeling safe to express their uncertainty about any process. Otherwise, if we create this opposite direction of dealing with those scenarios, they might even hold back from reporting, hold back from sharing their fears. So what you were mentioning about emotional intelligence into this matter exactly for our staff, I found it really, really nice, and it will support the Just culture and create this pleasant feeling for the frontliners.
I totally agree. The concept of second victim, it came up, I think, a few years back, reflecting of how traumatized can a healthcare provider feel when an error happened. Because as we said, we come to healthcare, we want to give. We want to put our energy in caregiving. But when a mistake happens, it's very stressful for people, and sometimes they cannot recover from it. I sometimes hear people talk about medical error that happened in front of them, or they were involved in it, and whenever they have tears in their eyes after years, because this is never their intention. And when it happens, it becomes very stressful on the person to accept it. So creating that environment that we can embrace our team and make them realize that mistakes can happen. And we need to make sure it doesn't happen again. That mentality, that environment will truly create the impact that we want.
Thank you, Doctora, for this interesting discussion. For me, I will not, if it is for the whole night, I will not stop this conversation. I really enjoying it, and I'm sure that all the audience, they enjoyed it very well. Thank you so much for this interesting topic. I always like your presentations, your discussions, because it is really informative. It's always giving us new information, new insights. It was really insightful and informative. Thank you so much for your time and efforts. I'd like to thank also all the audience that they reflect actually how us as healthcare professionals are really keen to improve and promote patient safety culture among our healthcare facilities. Thank you so much. And have a good night to everyone, and to you, Dr. Dina, if you would like to conclude with anything.
Thank you very much. It was a pleasure to have you all this evening with us. And thank you for spending this time for learning more to create a safer environment for our patients and their families. Thank you, everyone.